Good afternoon, everyone. I'm Deborah Craig Ray, General Manager of Goal One, Strategic Innovations and Public Affairs. It's my joy to introduce today's segment. This is a part of our celebration of annual National County Government Month. As you know, we celebrate this event every year. It is sponsored by the National Association of Counties. The goal is to feature the wonderful and outstanding work that is conducted by counties all across our nation. Today, I am very pleased at the webinar that we are hosting. Today's webinar will feature our Public Health Director, Rod Jenkins. As you know, it's called Lessons Learned from the Pandemic. You will recall that in early 2020, probably before any of us knew the name coronavirus, our public health director was already hearing about how this disease was moving across the nation and the world. And so we are very fortunate to have him here to share some of those behind the scenes meetings and strategies that they work through and develop to help keep us safe. I want to give you just a few instructions before we begin. We will hear first from Rod Jenkins, and then we will take questions. We will urge you to please put your questions in the Q&A box, and Dr. Alicia Smith, who is our communications manager for public health, will manage that process of addressing the questions and sharing them back out with Mr. Jenkins. So again, I want to thank you so much for the great work that you do with Durham County. And I will now turn it over to our wonderful Public Health Director, Rod Jenkins. Rod, the floor is yours.
Thank you so much, Deborah. And good afternoon to the listening audience. We thank you so much for being here with us to celebrate National County Government Month, a month in which we highlight all that's good in county government. And I can think of no better county government to be with and affiliated with than Durham County. It is a pleasure for me as Public Health Director to give you a little taste behind the curtain, bring you behind the curtain, if you will, to let you know all that has transpired, still transpiring, to be quite honest, with our pandemic response and some key lessons learned. Now, I will warn you that there is no way for me to really think of everything that we've done. I will say that the days and the nights were extremely long in 2020 and early 2021, but it was all worth it because we were successful and still have a modicum of success in keeping our community safe. And along the way, there were some valuable lessons, a couple of do-over moments that I wish I could bring back. But most importantly, we certainly have a playbook. And speaking of which, when we started, there was no playbook, ladies and gentlemen, at all. I remember it like it was yesterday, if I could take you back for a minute. January 13th, 2020 is when I began this fantastic opportunity to come to Durham and to embrace all that is live and vibrant about this foodie town, the Bull City. And I still maintain that fire within me to be here in Durham. This is definitely one of the highlights of my career. But I didn't know that a pandemic was on my heels. What I will say is that I quip from time to time. I did not bring COVID-19 with me. I promise I did. I got in place, and really and truly, before I could learn where the restrooms were, I had to go to a conference. And the conference was called the Public Health Leaders Conference, formerly known as the State Health Directors Conference. I was fortunate to be able to go. It's something that all health leaders, public health leaders in the state attend. And I couldn't enjoy the conference, ladies and gentlemen. I couldn't enjoy it at all. You see, they had formed what they call a war room within the hotel, the host hotel. And in that war room was our health leaders, to include state epidemiologist, Dr. Zach Moore, State Health Director, Dr. Betsy Tilson, the head of the Department of Public Health, at the time was Mark Benton, and countless others from epidemiology and communicable disease sections. And as a result, there were 3 public health directors that were summoned to that war room. It was myself, the health director for Orange County, and the health director at the time for the Division of Public Health for Wade County. And before we knew it, we were told that it was time for us to go back to our public health departments. Something serious was amiss. So that was a awakening of sorts for me. Upon making it back to our public health department here in Durham, I'd already called in to my deputies and say, we need to form our epidemiology team and we need to start convening because it's getting serious and we know that something is coming. That particular juncture, again, no playbook. The only thing we could do is exercise tried and true epidemiological practices that we've had for events like SARS, for events like the avian flu, for events like the unfortunate activity that happened as a result of the explosion here in Durham. Those are the type postures that we are used to, but we are not used to a long, drawn out event such as COVID. We are grateful, and you're going to hear me say this many, many times, but we're grateful to our partners at emergency management because as it stands right now, they have been our partners all along. We've been fortunate to have them to be with us shoulder to shoulder throughout this entire pandemic experience. So we formed our EPI team and we began to just wait. Upon waiting, we certainly welcomed emergency management and key personnel because we knew that we would need them. As time went on, things became a little bit more complex. So we knew that we needed to extend our bandwidth. So as reports came that we had travelers, as to be expected, the Triangle is a very robust area, transient population, a lot of people coming in and out. We knew that we would have eventual travelers to the Triangle area to come and to really, have the potential to bring the virus with them. And sure enough, it happened. So as time went on, we certainly continued to work at it, and we expanded our footprint. We included, law enforcement. We included fire. We included other emergency management personnel. We included the paramedics, EMS. We included food security with cooperative extension. We included homeless providers. We included so many people, and I know I'm going to get in trouble for missing several, but nevertheless, as far as the public health department was concerned, I put the entire health department on alert and let them know all hands on deck were needed. And from that particular juncture, ladies and gentlemen, life as we knew it in public health had changed forever. It's also important to note that throughout the pandemic experience, when the rest of the world were able to shelter in place and really begin to embrace technology that allowed them to work from home, public health has never really had the opportunity to embrace that until much later in our pandemic response. You see, we had to be here front and center. We had to be on the ground, absorbing the blows from COVID-19, if you will. And we certainly had to ensure that we were present and ready to be able to brief our elected officials on all things COVID and everything that came with it. I'd like to think that, we did an admirable job. As mentioned, the hours were extremely long. So let's go back to some of the lessons learned. I will say that we really, really sought to get buy-in from the community at large. We had over 300,000 people to protect. And that also meant that we had over 300,000 people to inform, to let them know what's going on locally. Everyone could look at CBS News and ABC News and NBC News. As a matter of fact, I have a distinct memory of that myself. I remember as I was making my transition to the Triangle, I was working extremely long hours. And in order to really burn off some stress, I went to the fitness center. And, you know, as fate would have it, I was the only one in the fitness center. And every single monitor in the fitness center, from ABC News to CBS News to, you know, to you name it, everything was on COVID. And you had one of those moments where you knew that life would not be the same. That was my personal revelation myself. I will say this. I'm thankful for those experiences. I'm very thankful. I mentioned elected officials, and I will say all of our elected officials, from the mayor to the chair to city council, board of county commissioners, the school board, I'm forever grateful for their support, their continued support to this day. They wanted to know what was going on, and the briefings, ladies and gentlemen, were plentiful. There was, at one point in time, I was briefing the elected officials on all things COVID on a daily basis. Then I went to every other day, and then eventually it went to just a weekly, bi-weekly, and then pretty soon it became monthly. And that was a collective, all hands on deck call. I'm thankful for the leadership of the city management and county management. Both city manager and county managers have knew my number, and they knew to call me whenever they had questions, whenever they were being questioned. So it was a tenuous time for me personally, because not only was I new to the town, I was just new to my position, but it was a pandemic and everybody wanted to really know what was going on. So that required me being accessible, and it certainly required me being as responsive as I could to all of the different demands imposed on me by the elected officials in county management. So again, we had to inform our community about the dangers of COVID. We had to get them to understand those things necessary to keep them safe. And, you know, as I mentioned, there was no playbook, but the only thing we had were the 3 Ws. We had to get people to wear a mask, to embrace wearing a mask. We had to get people to wash their hands, and we had to get people to social distance. Lucky for us in public health, this wasn't anything new. Every flu season, we tried to get our residents collectively as a public health workforce to do those 3 things in order to not have such a horrendous flu season. Magnify that maybe by 1 billion times. And that's what we were trying to accomplish worldwide in public health. I'm so grateful to the residents of Durham. We are an informed community, and they listen and they do their own investigating. And for the most part, what they do is they understood the gravity of the situation. And for the most part, they comply. And I'm forever grateful. But dealing with an unknown virus and all its variants continues to be a challenge. COVID-19 has proven to be extremely unpredictable. But again, we also had to communicate across generations, and we also had to embrace language barriers in the many diverse populations here in Durham. We also needed resources initially, because I could take you back, probably remember, when both locally, statewide, and nationally, we could not get PPE, which we affectionately call PPE, which is protective equipment, personal protective equipment, I should say. We could not get COVID testing, and that was a national problem that got corrected. We also had significant issues with the strategic national stockpile, which is supposed to be set up with robust supplies for events such as this. So the first initial response has been really troublesome in the early days. However, collectively, in partnership with emergency management and with our county managers' initiative and wherewithal, we were able to really be creative in ensuring that our residents and our workforce were able to do some significant things in order to make some things happen. I'm very proud of what we've been able to accomplish. I will also say this, we were ever so careful to know that we had to have a platform to be created to disseminate information to our community 24 hours a day, 7 days a week. And our award-winning data hub did just that. So grateful to our partners in EM, our partners at DataWorks, our partners in IS&T for helping us to create this data hub that to this day continues to provide statistics, continues to provide resources, continues to provide updates on where testing and vaccines are. It is what our community demanded, and it is what our community deserved. Some of the strengths that we displayed as a health department during this pandemic response. We're fortunate to have the majority of school health nurses to be employed by the Department of Public Health. I cannot thank them enough for their invaluable, dedicated time. Schools were not in session, as you can recall. So what did they do? They spent a tremendous amount of time helping us to case investigate and contact trace. Two words that are certainly inside America's lexicon now, because prior to that, it was just a public health jargon. But they spent countless hours helping us to develop a system that allowed us to feed information into our data hub, and our data informatics became stronger and stronger. We also are very, very grateful, if I didn't say before, but grateful for the support of our Board of County Commissioners, our Board of Health, our City Council, our school board. They all pledged their support, and they didn't just back it up with lip service. They put their monies and their resources and their funds where their mouths were. And there was nothing that was not at our public health's disposal in an effort to ensure that our residents remain safe. I can't speak enough about the partnerships and collaborations that came as a result of this pandemic moment. We've already maintained an excellent relationship with the universities here in Durham, to include Duke University, North Carolina Central University, Durham Technical Community College, and Durham Public Schools. But this was amplified during this pandemic response. We were able to do creative things in order to ensure that our residents continue to be safe. And Durham Public Health met with each one of these institutions individually to ensure that their staff and their students were safe. But then we had grassroots campaigns that came about to include the African American COVID Task Force Plus and Latin 19. I can't speak highly enough of these two groups because they assisted us in Durham with moving the needle and ensuring that testing and vaccines were going out to these historically marginalized populations as defined by the state of North Carolina. I cannot thank them enough, particularly given Latin 19's presence and their advocating for the Latinx population. I remember like it was yesterday. In April of 2020, COVID had hit the Hispanic population in great numbers, lots of infections, lots of misunderstanding. We scheduled a meeting with the Latin 19, and for the most part, we had some significant lessons learned, i.e., we had to fix our messaging. We weren't sending the right message to the Latinx community. We needed partners who could advocate on our part and really speak the language of public health to the Latinx population. Not that they didn't understand, but there's context in how you say things, because as we all know, words matter. And I'm just peacock proud and honeymoon happy to report that ever since that partnership has been established, we've been able to do amazing things to keep our Latinx community safe from COVID. Very grateful for that. Then, of course, there's additional grassroots organizations, community-based organizations to include Durham Tri, La Familia, El Centro Hispano, Peach 365, and many, many others that have done amazing work on the ground level through community health workers. Community health workers were not something novel that Durham County Public Health didn't know about. We've been using community health workers, employing them for many years, but we needed to expand this workforce tremendously. So again, we're thankful for the innovation and the collaboration and partnerships. Speaking of innovation, I'd be remiss if I did not mention that at the time, then former Mayor Steve Schul and former Chair Wendy Jacobs thought it not robbery to form a blue ribbon task force, affectionately known as the Recovery and Renewal Task Force. And they brought together, under the chairmanship of Katie Galbraith from Duke Regional, and Matisha Sims from Blue Cross Blue Shield. We were able to gather subject matter experts from every sector of our community to really discuss the pandemic, the current state of the pandemic, but more importantly, how would things look once we move forward, once we move out of this pandemic response in order to renew our community and to come back stronger. I was delighted to be a part of that task force. Steph, certainly one of the highlights of the early part of my career as public health director. And I think it was certainly a wise decision to really speak to the innovation of Durham County. One of the fine things that came out of the Recovery and Renewal Task Force were the roundtables. There were several roundtables that came out of it, from faith-based leaders to construction to fitness centers, you name it, it was there. And so proud to be a part of that. The roundtables really provided the avenue for those industries to really be able to ask pointed questions specific to what they do. And those questions were funneled up to the larger group, and we would have additional discussions. The Recovery and Renewal Task Force was initially supposed to be just for a short period of time. It ended up being a whole year, and it was a year well worth it. So we certainly are grateful to that. So again, lessons learned internally, as mentioned, emergency management, can't speak highly enough of them. I think before I go to the next phase, I'd be remiss if I did not laud and applaud and give kudos to the county's PIO team collectively. I can't speak highly enough of Dr. Alicia Smith, who's going to be our moderator, who's going to come before us in a few minutes. But of course, Deborah Craig Ray and Dawn Dudley and Randy Jones and many, many others. They helped to get the word out to those 300,000 plus people about COVID. We did lots of press releases. We did lots of community updates and bulletins. But I think one of the crown jewels of the public information response was something that I fought tooth and nail, but I heavily embrace now, and that's the health director videos. At one point in time, I was doing those videos probably every Friday, and without the help of PIO's expertise, lots of straight talk, just really telling it like it is and telling the Durham community what's going on and how best to protect themselves and their loved ones, we wouldn't have been as successful during this pandemic response as we have been. So again, I'm forever indebted to my partners from PIO, and I do believe that they assisted in really articulating the ebb and the flow of COVID-19. Where do we go in the future? You know, as I bring my presentation to a close, I'll just say this. We have no other choice but to continue to build on the fantastic partnerships that have come as a result of our pandemic activity. We have worked hand in hand with our community-based organizations. We have worked hand in hand with two of the significant grassroots organizations, the African American COVID-19 Task Force Plus, and also with Latin 19. We know that public health will never be the same, not just in Durham County, but throughout the nation. In Durham Public Health, we have embraced a hybrid approach. We do know that we're forward facing. There are clinical opportunities and clinical responsibilities that we have to do because that's just the nature of healthcare. But we do know that there are certain areas of the health department that does not have patient contact, and those can work remotely. So just like the rest of the world, we're doing our best to move the needle and ensuring that we're still able to do public health responsibilities, commit to those responsibilities responsibly, but also in an effort to keep ourselves and our communities safe, we're able to do much, much more. And it's been proven to be effective. There is value in communicating with the community, as I aforementioned. I do plan to continue to do health director videos every so often, but I'm looking forward to being able to do health director in-person chats or town halls, to be able to interface with our community and be able to truly be able to really get a feel for what they think and what they feel we should be doing in order to improve the health and well-being of our community. Durham has been different. Durham has embraced the changes that COVID has imposed upon us. I do believe that there's not a resident in Durham who will not remember COVID-19. And this experience has been a lasting experience for all of us. But I'd be remiss if I didn't say how proud I am of Durham. I believe in Durham. I've said it so many different times. I always end my health director videos by saying, we can do this, Durham. And I do believe that we are doing it. We have done it, and we will continue to do it. But I'm just amazed by this vibrant community that has shown so much resolve, shown so much caring and compassion throughout this pandemic moment. I do believe that as a result of the pandemic, we're just going to continue to be stronger because we know that we are stronger together. So I think I rambled a little bit with my presentation, but I get real fired up and I'm passionate about what I do. At this time, Deborah, I'll turn it back over to you or Alicia, but I'm ready for some Q&A.
Rod, I just want to thank you so much for that wonderful presentation. And I would just like to take a little moment of personal privilege to just thank you for joining Durham County in January 2020. And I do remember those early days. I remember that first news conference that we did together. I worked with you and Superintendent Mobenga to talk about what our community was getting ready to confront. I want to just personally thank you for your passion for this work, your expertise, your compassion. Because again, what moved me, every time you made a presentation to our Board of Commissioners, you always shared your sympathies to the families impacted by COVID-19. And so I think our community should be so, so grateful that you are here with us at this time. So again, my thanks for just being here with Durham County. And Alicia, I'm going to turn it over to you because I think we have maybe a few questions that our listeners want to hear. So take it away.
Thank you so much, Deborah, and thank you, Rod, for your comments. I mean, a lot of community members by now know your face and your voice from videos, the interviews, the in-person events and things, but it's really great to have this opportunity, of course, to ask you questions directly. So we do have some that we've gotten submitted in a few different places. So I will send them or read them to you, I guess, in the order that we've gotten them. So this one I think is a big question, but I'm sure a lot of people want to hear the answer to is what do you think, we need to do now to move from pandemic to endemic here in Durham County?
That's an excellent question. And I will say this, it is not going to be easy. And I will also say that we certainly know that, COVID-19 is going to be amongst us for quite some time. But at the same time, we should be able to live with COVID. And that's what we're doing right now. We still need to get more people vaccinated. and that's worth the pause. We still need to get more people vaccinated, and I'll say it again. Durham has been fortunate to be within the top 5 counties within the state, according to vaccinations, as far as full vaccinations as a measure of the entire population. And I give all kudos and all praise to my staff. I have some passionate public health practitioners that are committed to the community. And we spent the lion's share of 2021 really out in the community. And it is certainly one of the joys of my public health directorship. And we were committed to being in the sun, being in the elements, being in the rain, being in the cold, in order to ensure that our population was vaccinated. As long as the virus has a host, it will mutate and spread to those who are unvaccinated. That is a given fact. I know many in the listening audience have heard it many times before. So we also need to be bold and prepare ourselves to live with COVID. We know that there are many individuals who are not, warm to vaccinations, and that's unfortunate. We'll continue to work on them through social marketing and ensuring that they know the value of vaccinations. But we need to remain vigilant, and here's why. Simple. People are still dying because of COVID-19. It is an equal opportunity killer. And if we don't get the rest of our society vaccinated, it's going to always be with us. So with that being said, again, as I mentioned, we need to remain vigilant. We need to stay safe in our travels. We need to stay safe on our jobs. And more importantly, we need to stay safe in our personal lives. We do not need to walk around and act, carry on with reckless abandon like COVID has never been here before. And unfortunately, I've begun to see a little bit of that, not in Durham, maybe in neighboring counties. But I will say, again, we need to continue to be careful and be vigilant. And that's the way that we kind of make our march toward an endemic state. But we have a ways to go. Hope that answers the question.
Thank you so much. We will move to the next question. How do you respond to our citizens who question the validity of the pandemic?
That is a good question. An unfortunate one to be a good question. As Deborah Craig Ray has said, I take it personally when I have to report the number of deaths due to COVID-19. My heart's prayers and meditation will always be with those families. And that's one of the grim responsibilities that I have as public health director. My name appears on every death certificate for someone who passes away in Durham County. It is a sobering statistic. It's a sobering job that I take seriously. But when I report the number of deaths, and Durham continues to be relatively low compared to like-sized counties, I think we still have not surpassed 400. And that's remarkable given a raging pandemic. I say to them that it has affected me, the realness, if you will, of COVID-19 has affected me professionally and personally. The first death in Cumberland County, North Carolina, Fayetteville, home to Fort Bragg, was my fraternity brother, Ty Atkins. And he just happened to go to Georgia to check on his mother at a rest home. And we know back in the day, those nursing facilities were ripe with COVID. He got COVID, and within 5 days, he passed away. Many of us have loved ones, relatives, cousins, aunties, grandmas who passed away due to COVID. Please know, it is not a hoax. It is real. This virus has been killing people. As I mentioned previously, it's equal opportunity killing. If you're not vaccinated, please consider to get vaccinated. Please. Durham Public Health, I can think of no better facility for you to come and get your vaccine. Monday through Friday, from 9 a.m. to about 4 p.m., extended hours on Tuesday. And we work tirelessly with community partners and advocates to ensure that vaccines are available. There's a vial in every fridge. I can promise you that. Most doctors' offices, they have it, so you can get it. But please know, it's not a game. And 2.5 years into a global pandemic, trust me when I say it's real.
Thank you much for that answer, Rod. Next question we have, would you comment more on the COVID-related health disparities that exist in different segments of the Durham community, especially in those that are more economically challenged? What strategies are being most relied on to more effectively address any disparities?
Another excellent question. I kind of alluded to historically marginalized populations, and I'm fortunate to be good friends with the outgoing director of the Office of Minority Health and Disparities, Mr. Cornell Wright. I wish him well in his next endeavor. But the state stood up that work group to really do just that, to address the disparities. We do know that African Americans, both Black African Americans and Latinx individuals, are genetically predisposed to a lot of the health indicators that continue to kill us, to include diabetes, high blood pressure, cancer. All of those things affect these communities. COVID-19 just magnified it and just really exacerbated what's already been there. So of course, we want to make sure that they were first in line. So what are some of the things that we do? So glad you asked. We came out the gate and approached Anthony Scott with Durham Housing Authority, and we said, we want to set up COVID testing in your facilities. Can you allow this to happen? He did. So we had COVID testing set up in about 4 of the Durham Housing Authority sites. That went on for about a year, if not more. We worked with Latin 19 to ensure that those individuals of our Latinx community had those resources that they need, not just resources, but also information. I remember back when it was raging, you had a lot of individuals working construction sites. We also had many individuals, both in the Black and Brown community, that partook in multi-general housing. So again, one person gets sick, it would just ravage the entire community. Black and Brown folks have tight-knit communities. So as a result, we went the extra mile to ensure that those folks had the resources, had the information, had the knowledge. I'd be remiss if I didn't talk about our friends at LALE. Lots of radio station interviews, lots of Facebook Live events, anything that we could do in order to get the word out, to articulate that these disparities are real. We believe them, we understand all about it with public health, but to get them to understand the importance of getting tested, practicing the 3 Ws when vaccines became available and widely distributed on January 22nd of 2020. Partake in the vaccine. And I'd like to say that we were thankful. Do we have a ways to go, Alicia? We still got a long way to go. But nevertheless, we are much, much better than we were just a short while ago.
Awesome, thank you. Also, I want to know, I'm looking off to the side because I'm balancing questions being submitted in a few places, but I promise I'm listening.
It's all right.
All right. Your data dashboard indicates cases have begun increasing again. Is this due to the new variant, and when will you consider bringing back mask mandates? This is the $1 million question I get a lot.
I do, and you and I talk quite frequently. We know that the subvariant BA2 is out there. We keep a close eye on other jurisdictions in other states, and we know that, as I mentioned before, the Triangle is a very transient population. People come from a little bit everywhere. My commitment to the Durham community and my promise to Mayor Elaine O'Neill and Chair Brenda Howerton remains the same and in force. The minute that I see a sustained level of infection that warrants us bringing back the mask mandate, they will be the first people that I call. In the meantime, Durham Public Health stays on the ready, stays on the watch. I work in concert with our data team. I work in concert with our medical director, Dr. Jeff Jenkins, and we constantly watch what's going on in our community. The minute that our CDC level changes for a prolonged period of time, I will impose that mask mandate. In the meantime, in between time, we do know that we have sustained high case numbers. We don't want it to get as high as it was in mid-January, where we had on average 1,700 cases per day. But I think we could withstand a slight bump in cases. Nevertheless, public health at this time, ladies and gentlemen of the listening audience, we have gone from thou shalt and mandating to our traditional role, which is advising. We do know that this is an informed community that does the right thing. So we certainly know that you're keeping an eye on the numbers. And we also know that you're going to do those things to keep yourself safe, to include getting vaccinated, getting your booster, getting your second booster if you're eligible. And you're also going to practice the 3 W's, and you're going to spread that, good information to your loved ones and colleagues in order to keep them safe. Thank you for that question.
Awesome. Going forward, how do you balance the physical safety of children and teachers with the mental, emotional, developmental health of children, which has been damaged by masking, social distancing, and remote schooling over the past 2 years?
That's a tough question. And, it's a real question. And I will say this, the trauma that has been impacted on all of us from COVID-19's deadly rage and impact, it's going to take years to unpack. I'll be the first to admit to that person who posed the question, I don't have all the answers. We don't know what COVID-19 has done to any of us. We all have been impacted in some sort of way. I can tell you that Durham Public Health works extremely close with Durham Public Schools and with the charter schools in order to ensure that they remain safe, to answer any questions they may have. But we have heard from Alliance. My good friend Ann Oshel provided an update to the Board of County Commissioners a few weeks ago, and she has indicated that they're seeing unprecedented numbers when it comes to those individuals who have been impacted by COVID-19 from a mental health perspective. It is certainly going to take years for us to unpack. My recommendation continues to be, seek help. Do not be afraid. Do not be stigmatized. Do not be afraid to seek assistance. I will also say that, utilize those resources that are available in Durham County. There are many, they're plentiful. And I will also say, again, keep the faith, but do not be afraid to speak up when it comes to this, to mental health and COVID's impact on mental health. Sometimes as adults, we have to speak for children because they don't really understand what's going on or may not be able to articulate their feelings. But I do know that in the school systems, not just in Durham, but throughout the Triangle, they're seeing unprecedented numbers of individuals who are coming before them with mental health challenges. And we take them all seriously. Thank you for that question.
Great, thank you, Rod. The next message we received is not a question, but it's a comment that I'd love to share with you. It says, Director Jenkins' update videos were an information lifeline during the worst of COVID. 1 week when the vaccine first became available, instead of "we can do this, Durham," he said, "we are doing this, Durham." And hand to God, I cried. Thank you for keeping our city informed, and please keep doing the videos. I thought that was worth sharing. As
mentioned, I do whatever Dr. Alicia Smith tells me to do. She keeps me busy. But now, thank y'all so much. The videos truly did grow on me. The first video I did was with the former county manager. And, I like to say by now I got it all perfected.
Yeah, behind the scenes, the first couple of videos, we had some where we had 7, 8 different drafts of the recording. And that, by now it's rare that we have to do more than one. So what you all see in public is really a well-oiled machine at this point. All right, what was my next question? Oh no, I lost it. Oh, what is being done to protect the most vulnerable members of the community at this stage in the pandemic?
We're doing a number of things. Mass distribution still is available. Of course, you let us know who needs masks, where they are, we'll get them to them. We're continuing to work with our partners as far as vaccine distribution. Vaccine outreach, not as much, primarily because, you know, folks needed a rest after a year-long campaign of vaccine outreach. However, most recently, I want to say within the last month, we have done an outreach with our good friends at Partners with El Centro Hispanic. We continue to provide up-to-date information. And of course, we are working with the state with the Better Together campaign to ensure that historically marginalized populations have access and can access the vaccine. In the month of August of last year, we had a strong campaign in which incentives were provided. We received a strong outpouring of individuals who partook in the vaccine. But we do know that we need to circle the wagon and try to get those folks back in. And it's been hit or miss, to be quite honest with the listening audience. But we do know that it's widely available. There are well over 30 locations in Durham where you can go get COVID testing and you can get COVID vaccines.
Great, thank you. Do you have thoughts on masking as it pertains to those with compromised immune systems and or those who may not be able to get the vaccine for health reasons? Is it fair to remove the mask mandate and in turn force them to stay inside? And I started reading that while you were a little bit before I finished hearing your answer. So you touched on some of that, but would still love to
Absolutely. Thank you for that question to a member of the listening audience. I want you all to really know that it was quite the conundrum when it came to instituting the mask mandate, and more importantly, lifting the mandate. We do have county commissioners and city councilmen who are adamant that masking has kept our community safe. And, you know, both sides of the coin were really being flipped, you know, almost on a weekly, if not daily basis. Durham did not want to be the first to impart, to mandate, and we certainly didn't want to be the last to rescind. So there was that conundrum. But please know, in the middle were those people who we know are immunocompromised. And we want you all to understand that our stance has not changed. Wearing a mask is an act of kindness because you're showing that community, you're showing that person that you care about. You don't know what you have, they don't know what you have. So if you feel comfortable wearing your mask, please continue to do so. I know the Jenkins household continues to wear their mask. If Mrs. Jenkins has anything to do, we're going to wear our masks. But at the same time, we don't want it to be appear as if rescinding the mask mandate is some type of act of aggression. That's not it. What it is we certainly have an informed population that has, you know, done extremely well. And for us to get back into an advisory capacity, we cannot mandate our way out of this pandemic. We can't. So we know that this community, this vibrant community, this intelligent community is going to continue to read the science, continue to look at videos, continue to do what they need to do in order to keep themselves safe. That also applies to those who are immunocompromised and those people who cannot get a vaccine for whatever reason. Have quite a few of those individuals in my own family. And the only thing I can tell them is that continue to wear your mask.
Great, thank you. We have about 11 minutes left, so I think we can get through maybe 3 more questions, 2 to 3. If we go a little bit over, hopefully that's okay. If it's a minute over or 2,
sure. Absolutely.
Throw us out. This one is a pretty easy one. Any updates on vaccines available for under 5? I imagine kids under 5. Will they be available at the health department?
We are encouraged by word that we're probably looking at toward the end of this month, if not the middle of next month, for the FDA and CDC to kind of do their conferring. It is my understanding that we are extremely close. We recognize that there's pent up demand out there, because if your household is anything like mine, I only got one more left, and she's 4 years old. So I'll just say, we look forward to that thing. We are really looking to our pediatric practices to really assist this gentle population of Durhamites, primarily because, pediatric vaccinations are a little tricky. But we promise and we endeavor to ensure that those vaccines are distributed equally and fairly to those practices here in Durham. And we do know that there's a strong demand for it here in Durham. So I'm continuing to talk with my team through it, and we hope to render a decision. When we do, you can look to hear from the lovely Dr. Alicia Smith.
Great, thank you, Rod. With federal funding being reduced for free testing and vaccines, will the health department continue to make these available for free?
Absolutely. No change. Business as usual here at the health department. We will not allow those changes to impact our operations and what we do. We, as I've articulated to our governing board of county commissioners, public health has funding available to continue to meet that need, extending on throughout this year, and we plan to continue to do what is right for our community.
Awesome. And this one is a little longer, but I think it's an important one to answer as we talk about vaccines for kids under 5. With the data that has been shown over the past year of vaccines, we know COVID is not an equal opportunity killer. It impacts older and unwell people and has almost no impact on children. Do you feel comfortable, pushing vaccines for kids when the risk is so low and we don't actually know safety data?
That's a great question. And, we can beg to differ, because I do believe that COVID is an equal opportunity killer for those who are unvaccinated. We have a duty to protect those who are most vulnerable, and that also extends itself to children. At the same time, we do know that it is a personal decision. It's not a mandate. It's a personal decision. So with that being said, if parents don't feel comfortable with the science, or they don't feel comfortable having their kids vaccinated, please understand it's not a push from the public health, certainly not from this public health director. It's more of a strong encouragement. If you feel so inclined to get your kid vaccinated, please do. If it's not for you, and again, you still want to investigate the science a little bit more, talk to physicians or subject matter experts, absolutely. But please know, we do know unequivocally that vaccines are the surefire way to get to that endemic state. So I'm going to always encourage our listening audience to consider vaccines. But again, never been a mandate, not this way.
Awesome. And I think that's probably the last question we'll take, but one more comment, just positivity from the community. We love to see it. As a retired nurse practitioner, I am very grateful for Durham County's proactive and science-based actions regarding COVID-19. Mr. Jenkins' video updates have been excellent. Thank you to Durham County Health Department for everything they've done and continue to do to protect our community. Thought that was an excellent note to wrap up on.
I would have to agree. Thank you so much. I appreciate this.
All right, I think that concludes my part, Deborah, and we'll turn it back over to you to wrap us up.
Well, thank you so much. And Rod, just thank you again for giving it to us straight. Everything that your team has gone through over the past 2 years. And of course, the work continues. And we know that we are in good hands with you leading us and this effort. And Alicia, I'd like to thank you for always working with my team to make sure we do try to get the messages out appropriately, the right messages out to the right audiences, to work to keep our community safe. I'd also like to thank my staff, Dawn Dudley and Randy Jones, for their excellent work in supporting public health messaging, and of course, putting this wonderful webinar together to help us celebrate County Government Month. To all of you joining us today, I hope you have a safe and wonderful week. And as our health director has said, get your vaccinations. Bye.
Thank you all.
Thank y'all so much.